You submitted your application, you had the interview 12 weeks later. Tell me about your feeling when you heard about the comparability outcome. I mean, it's a long while back now, but tell me about that.
I was working in Nepean Hospital, and I remember Rami Sorial was the head of department, and I was very close to him.
Mm-hmm.
And I said, I had my interview, I'm expecting, and he started laughing. He said, Shiraz, if I have to hire you, I will hire you a consultant now,
Yes.
right? But why I laughed? I laughed because no one has done this from Pakistan and they don't know about it. So I'm really sorry. I'm not very hopeful that based on your application, they will accept.
Hello and welcome. My name is Dr. Rizwan Qureshi, and today I'm going to do an interview with Dr. Sheraz Anjum. Dr. Sheraz Anjum is a consultant trauma and orthopedic surgeon at Wollongong Hospital who specializes in foot and ankle surgery. Now, you'd say, why am I interviewing just any other orthopedic surgeon? Well, Dr. Sheraz Anjum is very special. So special that he is the first Pakistani orthopedic surgeon to obtain a specialist international medical graduate assessment from Royal Australian College of Surgeons for orthopedic surgery. So he has got plenty of useful insights to share. Dr. Anjum also is a director of training in orthopedics in Wollongong Hospital and has got his own busy private practice called Joint Vision. Please check out all the links and the conversation all about SIMG pathways in orthopedics. So without further ado, let's jump right into it. Thank you, Sheraz Bhai. I will call you Bhai, although I think both you and I are of the same age and from the same batch.
Yes.
Which takes me to my first question. Tell us something about yourself. I think you're a very interesting person, personally as well as professionally. So tell our viewers something about your professional credentials.
My name is Sheraz Anjum. I'm foot and ankle deformity correction, limb reconstruction and trauma surgeon in Wollongong Hospital. I did MBBS in 2002 in Pakistan. Then I did FCPS from Pakistan, and I did lateral entry and have completed FRACS, and I have done fellowships in my specialty. I wanted to use Middle East as a landing step so that I could earn some money and to get some exposure in the developing, from underdeveloped to developing countries, so that I can move to a developed country.
That is very interesting. Sorry to interrupt you, Sheraz Bhai, because what you're telling me is a very well-trodden pathway for most orthopedic surgeons and specialists. They graduate in Pakistan, then they do their internship in RMO years, and then they do their specialist training, because FCPS has got recognition in Middle Eastern countries. And how was your experience in Saudi Arabia? I'm kind of interested to know.
It was good. It has my personal experience was very good as compared to a lot of other people who are working around me and with me within the same department. I thought there were financial benefit for sure. And then there was exposure as well. So one of the problems which I noticed is I had a few Indian friends working there as well. So in India and Pakistan, you can say the developing countries, a majority of orthopedic training is based on orthopedic trauma only. Whereas if you read a book of orthopedic surgery or any surgery, there is trauma surgery and elective surgery. So elective surgery is not that common. So my exposure to elective surgery, like joint replacements, arthroscopy, deformity correction, was not very good. Obviously, we were not doing too many cases. It was very expensive to have joint replacement in Pakistan, and we were not doing almost anything in public sector anyway.
Tell me, when did you decide to come to Australia? You said that you came to Australia in 2013, but what led to that decision being made? It seems like the life is going pretty good. Good income, you're getting exposure in terms of joint replacement and arthroplasties. You're really developing as a good, very mature, seasoned orthopedic surgeon. Why Australia?
Look, I decided that while I was in Pakistan, that I will have to move to a first world country. At that time, the situation was not very good, and eldest in the family, had a lot of responsibilities. Got married early, had kids, so I thought it's better that I move to some other country. So then I thought, okay, what are the options? You have UK, you have USA, you can have Canada, you can have Australia.
Yes.
So in UK, I thought, okay, I had a chat with a few of my friends. There is a Caesar pathway, which is I just hate that, because you have to do FRCS.
Yes.
And then they put you in a line and you're nowhere. It takes you a lot of time. In USA, you have to do USMLE, and there is no clear
Yes.
pathway. If you are an overseas trained surgeon, can you be a surgeon in Australia, in America? And the same thing was in Canada. So
Hmm.
eventually, the options were either Australia and UK. So I thought Australia is better in a sense. They had a very clear pathway. Like they will assess you, they will tell you whether you are comparable, you are not comparable, right? And if you are comparable, you do this, this, and this, and then you have the exam. Once you have passed the exam, they honor their degree. This guy, this candidate is FRACS. No, is
Yes.
he or she is equal to us, and they can just explore the field. They can do anything.
That's a very good point. That Caesar pathway, I was actually exploring the Caesar pathway. People ask me question even in emergency medicine that I have actually done FR Chem through Caesar pathway.
Yeah.
Am I able to apply for SIMG pathway? They're actually not allowed to come through that. So there are two tiered of the same degree. Fine, you've explained very well that you wanted to come to Australia because of the reasons for Caesar. USMLE obviously is a very long pathway with USMLE and all that. And obviously,
Yeah.
Saudi Arabia, you're not going anywhere professionally.
For
So
that's a
tell,
professional death, I believe in Saudi Arabia. Like you just work in a middle grade job, you're working for somebody, you know they are not capable, but you are working for them.
yeah,
So I thought like if someone wants to move to first world countries and they want to use Middle East as a step, don't stay there for more than 2 or 3 years.
that is a good point.
Yeah.
Now, tell me more about the Australian specialist pathway for these overseas surgeons, because all of the surgical and allied specialty like neurosurgery, orthopedic surgery, vascular surgery, cardiothoracic surgery, plastic surgery, ENT, every surgery is recognized through this pathway, but we're going to focus on orthopedics. Tell me something about the orthopedic side of specialist pathway. How did you find that?
I did a research while I was in Pakistan, a bit of that at that time, and I was still a little bit vague, like I don't know how things will play up in Saudi Arabia and whether I will be able to go to Australia now. But once I was in Saudi Arabia, I started Googling everything. One
Okay.
of the problem in orthopedic surgery was I did not get a single person as kind of a source of who could give me some information about orthopedic surgery in general in Australia. So
Hmm.
I got a couple of guys, and I just wrote them 2 pages email, and I was given an answer of one line, or just refer to this website. So
Yeah.
I did a lot of work on establishing the facts which are important to proceed with any adventure.
Yes.
So I went on to first see the APRA website. At that time, it was Medical Board of Australia. Then they were newly forming APRA. So they had very clear guidelines written over there, which was the requirements of the registration. So this is
Mhm.
important. The registration requirements are different to the requirements of the college to be an orthopedic or any surgeon. So we have to simultaneously meet all those requirements. And in the center of those, which is the AMC, AMC has its own, recognition and importance, which we need to know whether you
Yes.
are lateral entry or you are IMG simply.
Yes.
So, and then I explored the website, which is the surgeons.org. It's a College
Yes.
of Surgeons website. And through that website, I moved on to Australian Orthopaedic Association's website. And while in Saudi Arabia, I realized that orthopedic training and everything in Australia is purely controlled by Australian Orthopaedic Association.
I
So
see.
they design the curriculum, they do every single thing,
Mhm.
training, exam, etc. And college is just a stamping body on it to some extent. Like college
Okay.
has its input, obviously, it's the most important authority in Australia,
Yes.
but you can say Australian Orthopaedic Association is doing everything for college directly, and college is observing and monitoring that indirectly, and they put their stamp on
So, what are the basic steps? Like, I know that, as you said, that there
it.
is EPIC, there's AMC, which is regardless of what specialty you choose, you have to do that EPIC verification of your passport, identity, your MBBS, and your specialist, that is FCPS.
Yeah, I believe the whole process you can divide it into two components.
Okay.
One is the registration requirement components, and second is the assessment component.
Mhm.
So the registration requirement component is basically AMC, where you had the ECFMG verification of your degrees, etc.
Yep.
And then requirements for APRA are basically you should be registered in your country of origin as a
Yep.
specialist surgeon.
As a specialist, yeah.
Whether it's whether it's 3 or 4 years, it doesn't matter. The second component is the application process itself. There is no universal consensus that no two training program in the world are similar. So at the end of the day, what you are trying to do is to compare and tell the Australian Medical Board or Australian Orthopaedic Association that your training program is kind of similar to Australian training program. The first important thing is to look at the requirements on the Australian Orthopaedic Association and College of Surgeons website.
Mhm.
Every training program has 3 or 4 components. The first component is eligibility to enter into the training program. Okay. For example, in Australia, you have to be PGY4
Mhm.
in order to apply for training program. You must have 6 points on your CV, and you must have passed the basic surgical exam. These are the criteria to enter into training program in Pakistan or India or whatever. The second component is the training itself. So in Australia, the training program is 5 years, which is considered 1 plus 3 plus 1. So
Okay.
first year is basically they just do mostly trauma, and the next 3 years they do trauma and elective. And at the end of 4 years, they take the exam, and the final year is considered a senior trainee.
Okay.
So majority of the training program in the world are on the same line.
Okay.
In Pakistan, I did FCPS. FCPS at that time was 5 years. It was. So, and Australian is 4 years. So,
Yep.
I had some family issues, and I had to delay my exam, and I passed my exam at the end of 4 years. So it
Okay.
was blessing in disguise for me. That's the what they highlighted as well. Although your training program is basically 3 years after, but you have done 4 years, 48 months. So it is similar to us. I said, oh yeah, that's really good. That was like not planned at that time.
Fair enough.
And the other important thing is like in India, if you talk about the MS orthopedic surgery, it's a 3-year training program, but they have at least 1 year of mandatory senior
Senior
resident.
resident, yes.
So that is 1 year. So I think that makes it 4 years as well. Because within the training program, then there are further requirements that you have to tell them. So the best way is whoever is watching this video and they're interested in orthopedic surgery in Australia, they should visit Australian Orthopaedic Association website, which is aoa.org.au. And in international medical graduates, there are a lot of information, and this is the same on the College of Surgeons website. So you need to see the curriculum of Australian Orthopaedic Training Program. And that's what one of the requirements is. You have to provide a curriculum of your training program to them. Okay, so then you can see, okay, what they are doing. They have to do arthroplasty, arthroscopy, trauma, spine, pediatrics, hands. And you just have to prove them that you have done all of those.
Yep.
And if you have not done all of those, then I'll tell what you can do. Okay, that's what I did. Okay.
Yep.
And then how do you monitor your training program? So I'm a director of training at Wollongong Hospital, so I'm heavily involved in the training and a part of regional training committee of New South Wales as well. So fortunately, I'm in a good position to guide your viewers that in orthopedics, we have assessment of our trainees on kind of weekly basis. Then there's a 3-month assessment, and then at a 6 months. Each term is 6 months. The first year orthopedic term is 1 year in one hospital. Then for next 4 years, they work for 6 months, and they keep rotating in various hospitals.
Okay.
So at the end of 6 months, I have to sit with the trainee and my colleagues, and I will decide whether this trainee has done enough. They have met all the requirements of this term. Overall, their behavior, etc., everything was good. So whether they are pass or they are fail. Finally, once you have completed the training program, included the research that you have to do, I think that is a part of every single training program in the world. So that research should be enough. Then the next part is what is the criteria to get to sit in the exam. Okay, so like you have to, for example, in Australia, we have divided our training program into 9 modules, like shoulder, hip, knee, foot and ankle, trauma, hand, spine, pediatrics, I think tumor and other systemic medical condition, etc.
Okay.
So they have to pass at least 6 modules before they can take the exam, and
Okay.
they must have done all the research. Similarly, that's what you have to provide them. In my country, this is the criteria to be eligible to take the exam. Then the third component is how the exam is conducted. For example, in Australia, we have a written exam, which has 2 components like short essay questions, long essays, and MCQs. And then we have kind of a very robust physical examination where we have 5 computer stations, and we have short cases, long cases, etc.
Okay.
You have to tell them how the exam is done in your country, what are the components of the exam, and who
So
are the
comparing the
examiners.
components of FCPS, that written
FCPS
component
or MS.
and the oral components, you have to match it with that of the Australian exam
I
component.
believe they are
Exactly.
all similar. There
They're all
is not
similar,
much
yes.
difference. They are all
Yes.
similar.
Do you have to mention that, look, this is the MCQ component which I took at the initial start of my training, and it was 2 hours long. It had basic anatomical subjects. How much detail should be included in that?
I think once you get the copy of your curriculum from your college, and
Yep.
it will highlight. You can just simply say like and you don't have to tell them. They will ask these questions in the interview.
Okay.
And they will have read your application top to bottom.
Okay.
Finally, it comes to the postgraduate experience. The more experience is always less. There is no limit to that one. And then finally, your logbook.
Yes,
logbook
logbook.
is a
That
reflection
is
of
very
what
important.
you
Yes.
have done.
Yes.
What you have done. So I would say there are 2 important things when you prepare your logbook for lateral entry in Australia. One is, in Australia, there is no such thing as independent surgery. That's what, like, I had a mindset as well. Like in Pakistan, I was doing like, I was a registrar of the ward, and I was operating 5 days a week, and my boss was happy, and he gave me theater every day, and I was just doing operating. If my registrar might be the first assistant, or they are the primary surgeons, either I will be scubbed with them, depending on if it's 4th year or 5th year training, I might say if you're fixing an ankle fracture or doing something else, a disc radius fracture, like you can start and do the case, and I will be in the room or
That's true.
sitting in 3 room and just going back and forth and seeing what they are doing. So please be very careful when you write like in your logbook, like, oh yeah, my professor was like in the private hospital and did like 500 cases, and he was very happy, and I was the best surgeon. This is all. When you write your logbook, they don't need the detail of every single case. Like on 5th of January, I did 5 cases, and 7th of January, I did 2 cases. No, it doesn't work like that. What they need is a summary of your cases that you have done.
Like a transcript.
During your training. Transcript, exactly.
Yeah.
So, for example, you can make a page of, arthroplasty, and you can say, right, okay, primary knee replacement. And the next is under supernumerary. They have a template on their website anyway.
They've got a template,
like
yes.
I did, yeah. So you can just put how many cases you've done. At the end of the day, I can tell you that Australian trained surgeons are capable of doing most of kind of middle grade trauma, or simple like with the moderate complexity as well. Every candidate is capable of doing mostly knee replacement and a hip replacement. Good candidates are able to do some sort of a simple revision as well.
Okay.
They are able to do ACL reconstruction independently most of the time. They can do most of the knee meniscal surgery independently. They are able to do shoulder arthroscopy independently. Some who are very good, they might be able to do, the arthroscopic cuff repair, rotator cuff repair, but open cuff repair is considered an essential thing. Like they are able to do that one.
Okay.
So these are the things that you should be able to do. If you
That's
are not
a very
able
good
to
point.
do,
So now
very
you
important.
basically just told that this is the bare minimum expectation. And in Pakistan, as you said before, that they're not getting arthroplasty exposure or arthroscopic exposure. It's very expensive. So that becomes tricky then, putting on a logbook or trying to justify and garnish that.
Absolutely, absolutely, and that's what I did in my lab. That in my training, I have limited exposure to arthroplasty or arthroscopy. But when I went to Saudi Arabia, then my skill over there got nourished.
Mhm.
So one logbook is from your training program. So your bosses or your chief supervisor has to sign those.
Yeah,
Then if you are currently working in your country of origin as a specialist surgeon and you are having private and public practice, then
that's
you
right.
can make a logbook of that as well. Okay.
Okay,
So you
yes.
can ask your head of department to sign your logbook and you can write that as my work as a consultant.
Now we've talked about the application in terms of identification, Epic AMC. We've also talked about briefly matching the training back in Pakistan, India, in terms of training year, including the SR year to make it that 4-year composite, which is a bare minimum requirement of that of here in Australia.
Yep.
You very correctly highlighted the logbook requirements because people tend to get a bit worried about the logbooks, and it's transcript simple. You divide them into various sections. Now
Yep.
tell me something about your specialist college interview. Now I've heard it's 90 minutes long. They go through your training. There's some clinical questions. There's some cultural competency question. There's questions about teamwork, collaboration, clinical prioritization. It's quite detailed. It's not like walking in and just regurgitating your CV. It is actually
Yep.
judging you at a level of a consultant almost, how orthopedic trainee going into consultancy. So tell me about your experience. How did you find that interview process, Dr. Shiraz?
I was as honestly surprised to see that they were well prepared. Like I thought they were over prepared, and I was probably under prepared. The interview panel is generally a very high level panel. Okay,
Okay.
so in my interview at that time, I had the president of Australian Orthopaedic Association, a very senior orthopedic surgeon as a second surgeon.
Hmm.
I had the vice president of College of Surgeons,
Okay.
which is the RACS.
Hmm.
And then I had interview a female who was basically from the legal side of things. And they had their notes. Everyone had highlighted. I could see in front of my eyes, like, okay, oh my God, what is this that I have written? The red light and the green and the yellow and
Yeah.
whatever. It does not necessarily mean then they will have highlighters with them. But basically, the idea is they had read each and everything of my application. So be very careful what you write in your application, and being honest is the most important thing. Don't make up. So in the
Mm.
first half of the interview, they will just verify what you have written.
Okay.
Okay. Tell us about like how did you get into orthopedic training? I said, oh yeah, I did FCPS Part 1 at the end of internship, and these are the requirements. You can see that I have attached the curriculum of FCPS 1, and we had a long chat, like all those things that we discussed regarding the induction criteria, training, examination requirements. They ask all of those things again. The second part of the interview starts.
Okay.
That is based on, if you go to the college's website, which is surgeons.org.au, there are nine competency criterias,
Hmm.
which is things like education, research, communication, ethics, all those things.
Hmm.
So the interview is basically based on those criteria, where you will have ethical questions mainly. They will ask you about your research, your audit, clinical governance. These are the things. They won't ask you questions directly regarding orthopedics, like, oh, okay, if you have a pelvis fracture, how will you fix it? They won't ask you those
Okay.
clinical questions.
Okay.
They are basically non-clinical questions, and they are equally important. I was asked, like, there is a 90-year-old gentleman who is demented and has landed in the emergency department at 11 p.m. on Friday night. Saturday, Sunday is a public holiday, and how will you proceed with the consent process? Right? So these are the things like, okay, the patient is competent, non-competent, is there any next of kin who has authority,
Yeah.
a legal guardian, and then the tribunal asks
Yes.
of
Yes.
that thing they must know, and then is there urgency, the medical workup, your DNR stuff, These are the basic things that the candidate must know, and these are the things which are never discussed in unfortunately in our countries.
No, this is
Um,
so true. And this is cross college. These cultural
absolutely.
competencies, these ethical competencies, they're in ASIM, they're in RACP, RACS, and you must know about it because we deal with these situations every day. The
Yep.
other day, I had
Yep.
a patient in emergency department
Yep.
who was under a legal guardianship. And she needed a surgery. I had to approach the legal guardian to get a
Yep.
consent. So
Yep.
these are very practical issues. You're absolutely right.
A 50-year or 55-year-old patient who is being seen for elective hip replacement to be done in a couple of weeks. The patient is non-English speaking.
Hmm.
They are Jehovah's Witness. They don't want blood. And the HB is, say, 90, right? So the surgery is planned on next Thursday or next week, and you are the consultant, and the patient is here for a pre-operative assessment.
Yeah.
So how will you assess? So the important thing, these are the things. For example, just to explain a little bit about this question, like Australia is a multicultural country, so not everybody speaks English. Okay, and you cannot legally use patient's son, daughter, next of kin, or a friend as a translator.
Yes.
Medical legally, you cannot use that one. There is a 24-hour translation, the website, like the link,
Services
that
in
service
most hospitals.
available.
Yeah. You've had the interview. How long does this process take? The application take to get an interview and getting the final comparability outcome, which we'll talk about in terms of, 3 outcomes. Well,
Yep.
basically, there are 2 outcomes. The third is no.
Third is generally not fast. Yeah. So officially they say it takes around 3 months for the first part, which
Yes.
is like so. So the first component is you put in the paperwork. It took them like I think 8 months for my application because I'm first Pakistani who got accepted through lateral entry, and they said, "Oh, we have never seen this application before. We had a
They've
few
never
candidates,
worked
they
with
were rejected."
FCPS before.
They had, I think, a couple of guys, and they rejected them. They never
Wow.
went on to assess
That's
them properly.
interesting, Shiraz bhai. You know what happened? I've come across urologists from Pakistan, FCPS urologists working in Mayo Hospital in Lahore, who have done the same training, but their application did not float. It just goes
Yep.
on showing that if you're not careful with your application details, your
Yep.
application will stall.
I say like you need 1 year for this process.
Yes,
Okay, it take
absolutely.
at least 6 months to just do or organize all the paperwork, and that is very robust. Like one of the requirement is you need to provide a guideline or a document from the registration authority in your country that okay, this training program is acceptable, and this trainee, once they have completed the training program, they will be eligible to be registered as a consultant. And then you have to have patience. Every single component, every single paper of your application has to be signed by notary public as well, or justice
Yes.
of peace. So it takes 6 months to just prepare the application. Once you put the application in, they will see it provisionally, and they will get back to you, and they will ask you sometime few more information. Provide them, and once they are satisfied, they will ask you, are you satisfied with the application? If you are satisfied, then we will activate the application. It took long time for them for my application, but hopefully it will be easier for the other candidates now.
Yep.
And once, I think 3 to 4 months later, they will let you know whether you will proceed to the next step, which is interview. They will give you at least 6 weeks generally for interview to prepare. And I went to Melbourne in the headquarters of the college to have my interview. And it takes them around 4 weeks to let you know about the outcome of the interview.
Yeah. So in the application in itself, we're just going back a little bit. I also find that you're absolutely right. The list of the things that you have to attach, getting that list of documents, like going to the college, getting the curriculum, getting that FCPS or MS is the highest level exam in my country, which is approved by the PMDC. That is going to take a hell of a time, especially in our countries where, the machinery is so. The other thing which I find, because I've been helping with lots of application, Dr. Shiraz, maybe you might be able to shed a bit of a light. Sometimes applicants put in very minimal details on their application in terms of when it comes to the section of your duties, like what duties were you doing, um, clinical responsibilities, non-clinical responsibilities, managerial responsibilities, their procedural skills section. It's just, I, I, I often feel that it's a consultant level explanation which is required, and the details, how valuable those details in the clinical duties and responsibilities are important, in your opinion?
Oh, extremely
Mhm.
important. I would say probably is a even stronger word than extremely. I would use that one. Okay.
Okay.
The important thing again to know is like when you are intern or you are then next step is unaccredited registrar or a basic trainee registrar, then trainee registrar. These are three different jobs.
So I think we need to have an understanding of what interns do, what residents do here
Yes,
in Australia, and then try to match
exactly.
those words. And there's so many job descriptions out there which you can
Yeah.
explore and make it really good. So you submitted your application, you had the interview. 12 weeks later, tell me about your feeling when you heard about the comparability outcome. I mean, it's a long while back now, but tell me about that
Yeah, it
hard
was
work.
it was unbelievable feeling. I can't tell you honestly.
Coming
The
first
reason,
time from Pakistan, right?
yeah, coming first time from Pakistan and then going through all the hard work and day and night work. And I remember that day I remember for sure. Like I was working in Nepean Hospital, and I remember Rami Sorial was the head of department, and I was very close to him.
Mm-hmm.
And I said, I had my interview, I'm expecting, and he started laughing. He said, Shiraz, if I have to hire you, I will hire you a consultant now,
Yes.
right? But why I laughed? I laughed because no one has done this from Pakistan and they don't know about it. So I'm really sorry. I'm not very hopeful that based on
Mhm.
your application, they will accept you, right?
Yes.
And I was in the car park. Partially, in the same day, we did like I think I did 3 knee replacements on that day. I remember that. I was in the car park. I just opened my mobile and there was an email saying, yes, you are partially comparable. And I called Rami and I started laughing. He said, what happened? I said, this is the letter. So, oh my God, yeah. And that day he said, like, 2 years of further training, you are doing it here.
Mhm.
And I believe you will pass your exam in 15 months or before that.
Mhm.
And I thought, what are you talking about? And that was right. Like I was probably one or two of the lateral entry guys who passed their exam before the requirement was even done.
Wonderful.
So we'll discuss about
Mashallah.
that. Yeah.
That is amazing.
Yeah.
So that is kudos to you. I mean, all that hard
Mm.
work, as you said, it's not just the filing of the application, it's a hard work, taking the time with each and every section, each and every document, logbooks, interview preparing. It's
Yeah.
definitely it's worth it. And plus, in one of the most competitive specialties in Australia,
Yep.
like
Look,
orthopedics is the most competitive surgical specialty, I think, in Australia.
that's right. We have every year around 250 candidates nationwide, and we hire at the end around 40 to 45 a year. And the important thing is once you get a letter, which is mostly you are partially comparable or you are substantially comparable, which is less likely for us, you are not comparable. So
Mhm.
I would say most common scenarios either you're partially comparable or you are not comparable. If you're not
Mhm.
comparable, then you're done. So
Mhm.
don't waste your time to go for application again or appeal and everything because
Mm.
um, you cannot change a lot if you go into appeals. Okay, so I would say
And
just
I
close
tell
that
you
up.
one thing why is that because once you've put the details, the factual details, you cannot go and change them. Oh, I missed that part
Exactly,
because
exactly.
it's all under a declaration.
The reason for that is they won't simply say that they have rejected you based on that your logbook is not good. It's not that. So they will say like based on the assessment, we feel like overall we believe that you're not comparable. So that
Mhm.
includes training, exam, all the things that we discussed. So if you will go into appeal, the only thing that you can change is your logbook that you have worked for another year or so and you have done like another few hundred cases,
Mhm.
but your education remains the same, your training remains the
Exactly.
same, so basic criteria of assessment are the same.
Yeah.
So I
Yes.
don't believe that is the reason I feel like just close that topic. Don't waste your money and just get on
Mm.
with life.
What? Yeah. What? Just
The
please highlight
experience
what.
that I did, yeah, the
Yeah.
experience that I had in Australia before doing the lateral entry, that was key, I think, in my application as well. Apart from the Saudi experience that I had for 3 years,
So
two
did
and
you
a half
come in
years.
through short-term training pathway at that time, or how did you, because you're already working in Australia when you filed for an application?
Yep, yep, yep.
Hmm.
Yeah, so I got registration with the APRA, which is called a limited registration. I
Yeah.
got a fellow's job in Liverpool. We are not. So I did
Yes.
AMC one while I was in Saudi Arabia. I think I will
That
discuss
is,
about that also. That's
yes,
very important. So
that is very important.
they
Yes.
said, oh, it's a junior position. So based on your AMC one, we can give you limited registration, which again proved as a blessing in disguise for me as well.
Yeah. Yes.
So I worked as a fellow in trauma surgery for a year and then
Hmm.
general orthopedics for another year.
Hmm.
So this was important for me because while I was working in Australia directly in the country where you want to stay,
Hmm.
and with the surgeons who assess your application to an extent, and I had my own logbook and I had I think 1,000 cases on that, and that
Hmm.
helped me a lot. So
Hmm.
basically any ambiguity that this person is capable or not capable, if there was any deficiency in the training program, it just covers that.
Hmm.
So my strong belief is those who are coming from India or Pakistan, they should work in Australia for a couple of years as a fellow.
Hmm.
Once you get local experience, and then the local guys will sign your logbook and they will be your referees, that will carry a lot more weightage than what you will have from Pakistan or India.
100%. Because I've seen trauma surgeon coming here from India doing exactly the same thing. They find trauma fellow positions,
Yep.
they do those positions, and then they apply for specialist recognition. Now, one thing which
Yeah.
I often get asked, like, what would be the way? I mean, obviously, you had done the AMC exam. Do you think it was
Yeah.
helpful or not helpful, or how do they find
Um,
those positions, those fellow positions, or is it
if
tricky? Or
yeah, so for to find a fellow position, you don't need AMC.
yes.
Okay, so as I mentioned, the requirement of APRA is if you have a degree based on which you can work as a consultant in your country of origin, and you have ECFMG paper with you verification, and you have done the IELTS requirements, then they will give you registration as a fellow.
Mhm.
So it's
Yes.
called limited registration,
Hmm.
and it will be with particular surgeon or and a particular hospital. So you don't need AMC basically for lateral entry.
Hmm.
But for me, it was helpful because I had done AMC. I was here with my family. And in order
Hmm.
to get PR, which is permanent residence as a doctor,
Hmm.
you have to have general registration with APRA or Medical Board of Australia, or either as a basic doctor or as a specialist.
Hmm.
So I thought if you go to the specialist pathway, it takes around 5 years. So 5 years you are on your own, you're like having extra expenses for your
Hmm.
family. So I did AMC, and that helped me in the sense that once I had done AMC, they gave me registration based on AMC. They said it's the same, but it will be beneficial for you,
Yes.
and that became beneficial because I did an AMC two as well while I was in
Okay.
Australia in the first
Hmm.
year. Once I had done that one, then I applied for general registration. So they said, you have not done, those
Medicine
in
and
medicine surgery, the
yeah.
48 weeks of
Yeah. Yeah. Yeah.
internship.
Yeah.
But I said, look, I'm an orthopedic surgery, and I intend to, pursue my career in orthopedics. They said, okay, we can give you general registration, and we will put a restriction on you that you can work um, as a non-specialist doctor in orthopedic surgery only. I said,
Okay.
that's fine, but it
Hmm.
gave me the label that I have a general registration, and
That's
I
true.
was able to apply PR.
That's good.
So that helped me in that sense
That's a
that I
very
think,
smart move. Not many people do
yeah,
that, Dr.
yeah.
Shiraz. That's a
So I
very
think
smart
in
move.
in 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 15, 18 months while I was here, I got
You were
PR.
permanent. But
Yep.
tell me, for the people who are doing the specialist assessment now, how easy is to find or how difficult is it to find the first, top up training time that you have to do for 24 months and you have to pass exams during that? What kind of jobs, unaccredited registrar jobs? how's that process? And you have to do a couple of other things. You have to do modules like operating with respect, and you have to also do some cultural
Hand
competency
hygiene,
modules, the hand
culture
hygiene modules.
competency,
Yeah,
hand hygiene.
there's
Yep.
quite a lot going on in 2 years, right?
Yeah, that's right.
Mm-hmm.
So once you're partially comparable, then they will ask you that you have to pass the FRACS exam, and you have to work under supervision for 24 months.
Mm-hmm.
And they will give you a total of 48 months to complete that thing.
Okay,
So
so double that
I will
amount.
highlight. Yeah, I will
Mm-hmm.
highlight that. How does it work? So
Mm-hmm.
the 48 months time starts from the first day you join the hospital and you put your paperwork into the college.
Okay.
Okay, so you have to find a job. We
Mm-hmm.
will discuss that one, and then you need at least 2 supervisors who will supervise you during that job to
Mm-hmm.
fill in the requirements and complete the requirements of the college.
Mm-hmm.
So once the college will receive that paperwork signed by 2 consultants, that is the day they will start counting your
2
training.
years.
They divide those 24 months into 8 quarters. So
Okay.
3 months is a quarter.
Mm-hmm.
In each of the 3 months, at the end of 3 months, you have to submit your logbook. They will give you access to the MALT logbook, which is available on your college website.
Okay.
You need at least one DOPS, which is directly observed procedure skill, like the consultants will say, yeah, he has done a knee replacement with me, with
Mm-hmm.
this, that, or we did a simple fracture or whatever.
Mm-hmm.
And then one is called mini CX, which is basically a discussion and case presentation, something like that. And once you have passed 3 consecutive terms, 9 months of term total out of the 24 months, then you will
Mm-hmm.
receive an email that now you are eligible to take the exam.
Okay. All right.
Okay. So, but majority of the people, they will basically wait for the 24 months, and then some people start preparing for the exam once they have started everything,
Mm-hmm.
and they get too late by the time they start preparing the exam. So I
Mm-hmm.
started that the day one. So you have to work simultaneously on a lot of things.
Mm-hmm.
So once you have done, as I mentioned, 9 months, they will receive a letter that you are eligible to take the exam. At the end of 12 months, apart from the routine things that we saw, the logbook and mini CX and tops, you will do a 360 assessment as well. The couple of things with the exam and the training pathway is you are being, once you apply for the lateral entry, you are being assessed as a general orthopedic surgeon who has just completed the training program in Australia. So if you are a knee surgeon in your country, then they are not going to assess you as a knee surgeon. There's no guarantee that you work as a knee surgeon, right, in Australia.
Yes.
Even if they assess you based on each and everything. This exam is a proper. You have to read and write every single thing.
Mm-hmm.
So it is important that you try to get into study group with the local trainees. And there is a bone school available, which is a very organized teaching program run by the association.
Mm-hmm.
In New South Wales, we have it on every Tuesday afternoon. So I think when I got the email, I applied for the next attempt. That was, I think, 3-4 months later,
Mm-hmm.
and I failed that attempt.
Mm-hmm.
It's important to say that you sometimes you fail in your life. That is very important because
That is a
I
reality.
went.
Yeah.
That's the reality. I went to New Zealand, and obviously I was sad. Like, it's a reality. It's okay. People fail in life, right? That's not a big deal. But the next exam was 3 months later, and I passed it. Like, it was the best exam in my life.
Yes.
So the important thing, why I said that one, is not that I want to tell people that if I'm show off, it's not the reality. The reason for that is in the first exam, I tried to be like the locals.
Okay.
The way they speak, the way they deal, and I felt that I was not able to communicate properly with my examiners.
Okay.
Right? I was not using the right words and this and that. Like, you try to be pseudo and race, right?
Mm-hmm.
You cannot be that one. What I'm telling is basically be what you are.
Mm-hmm.
Speak the way you speak, because that is the best way. At the end of the day, examination of any surgical specialty is not done in operating theaters. You don't have a knife in your hand. right? You just tell
So
them
true.
the way you do the thing.
What are the chances to find that job in which you're doing your top-up training?
It is difficult. I won't lie on that. There are very few jobs in the public hospital, public as well. So if you're working in a public hospital, every day there's a different consultant. You are responsible to look after them, and they are always, thankful that you're looking after their patients.
So you can work in a private hospital as well as a top-up training.
You can work in different as a fellow with in the private sector as well, but it has to be a bit more general fellowship. Like like I'm a foot and ankle surgeon, I have my own fellowship, but the guys who are going to work with me will not get that job accepted. The college has to accept that job.
Okay. Yes, because
so
it
one
has
of
to
the
be
criteria
general.
is
Yes.
it has to be general job. So the job, like the job description that you apply for, they give job description, you have to send that job to college. Like this is a job that I'm going to use as my supervised practice. They have to approve that job. So you can't do it. I know one or two guys did a 1 year in the private sector, but there was a lot of paperwork. I do know in South Australia and Queensland, there were a lot of areas where they were struggling to find somebody.
Yes.
But that is not very well advertised.
Shiraz, I'll tell you one thing. When I was looking for area of need jobs, there are area of need jobs for dermatologists, ophthalmologists, orthopedic surgeon, and they are not very well known. You are absolutely right. There are jobs, you don't know how to find those jobs. It is a bit tricky. And plus, when you get shortlisted for a job, that's another thing. How to interview, how to do that is another part of the
Absolutely.
aspect.
And my feeling is if you have worked as a fellow before the application process,
yes,
then you will have some links.
You got your exam result. Tell me about the feeling on that day. Because
yes.
I remember my fellowship exam result when it came out. I literally cried. Literally, I cried.
So we were checking, I know they said the result will be on your portfolio on the college website by 9 o'clock. And we starting, seeing it at 7:30.
Yes.
And eventually, I remember 8:50 it was the time, and we just clicked, and you only see pass or fail. Right?
Yes.
And it was pass. The first reaction was, although, as I mentioned, my exam went really well, and we had that feeling inshallah, it is going to be good this time for sure. Yeah. But the first reaction was I refreshed that page.
Yes.
Just to make sure that it's still a pass, right?
And you check from different computers.
yeah, that is right. So that was really epic. I mean that's a long story. You can't describe it.
Yes.
You have done MBBS training program. I went to Saudi Arabia. All the fellowships and the problems that my family, my kids faced throughout their time. To a point, you feel like I got what I wanted, right?
Yes.
So words and cannot be, cannot describe your feeling honestly.
Absolutely,
it's a moment. I think it's a moment.
Yeah. It's a moment
that you just cherish. Yes.
You're right. So working as a consultant in Australia, there are a number of options. You work as a VMO, you work both now in public and private sector. How are the opportunities as a consultant after you've done through your lateral entry, SIMG pathway, applications, passing the exam? What are the opportunities for consultant orthopedic surgeons like for international medical graduates?
Yeah, I won't be negative, but the reality is there is a lot of competition. Okay. For example, in New South Wales, around 20 candidates pass each year, and they are looking for a job, and you will have 7-8 jobs maybe each year in the public hospital. I'm talking
in
about.
A public hospital, yes.
In a public hospital, that's important. We will discuss it why it is important. So, but I got a job. I am IMG. I'm not a local. I'm not a local trainee, and I had the option of job. And I worked in 3 hospitals only, and I had the option of getting job in almost all of those hospitals. I'm lucky. I'm blessed. It's just from Allah. It's not that I'm very good. You should be thankful and humble that if you can get a job. So
Yes.
the idea basically is, put it this way, in our department, if we need an upper limb surgeon, for example.
Mm-hmm.
So we will know that trainees who have been working with us in the last few years and those who are working around, at the end of the day, we will see, okay, this candidate is a very good surgeon. We can get along well with that person. Once that person becomes a part of the department, then the only reason they will die is do something really, really bad, which
Really
is
bad. Yeah.
extremely unusual, or they will
Mm.
retire. Okay.
Yes.
So you
Yes.
have to work with that colleague for the rest of your life. So obviously, those things make a big difference, and people start looking at those candidates. And if
Mm.
you fit in their criteria, then you're kind of shortlisted. And by the time
Yes.
the job is in the paper and you have the interview,
Mm.
you there's likelihood that you will get the job, but it is difficult. Okay.
It is difficult.
Now, in Australia, if you have a public hospital appointment, that helps you a lot.
Mm-hmm.
The reason for that is you have a job and you start setting up your private practice simultaneously or after a few months. So
Mm-hmm.
there's a plenty of work in public, and you get paid very very good amount in the public
Mm-hmm.
hospital as well.
Mm.
That's important so that you can pay your bills and you are guaranteed that you can earn money. Right?
Yeah.
The second important thing, as you know, in Australia, it's a very well established health system where the patients are seen by the GPs or primary care providers first, and they will refer those patients to you in your private practice. The patient, they
Mm-hmm.
don't come and see you directly. Like if someone
Mm-hmm.
has an ankle fracture,
Mm-hmm.
and either they will go to emergency, or if
Mm.
it's not too bad, they might go to the GP, and GP will do
Mm.
X-ray and everything, and then they will refer to a public hospital or a private surgeon.
That's right.
So if you have a public hospital appointment, that helps you to build that practice, because GP will send a patient most to the person who can see both public and private patient.
Yes.
And if
Yes.
you don't have a private public health appointment, then it becomes difficult for GPs to send you patient as well. So it takes a bit of
Yes.
time.
The last, I'd like to get your final recommendation. What is your recommendation for people in India, Pakistan, or any other part of the world who would like to come through SIMG pathway? What would you advise them?
Few things are important. It will suit better to a relatively fresh candidate. Like if you have passed your orthopedic training program just now or a couple of years ago, and you're just trying to sort out your preferences in your life, that is the ideal time, because you're still young, energetic.
Mm-hmm.
And if you come here and you work as a fellow, you're kind of working as a resident registrar again. So you
Mm-hmm.
don't get that mindset like I was a boss and I'm a consultant,
Mm-hmm.
because that mindset can make or break you. Secondly, it's not a simple process. It will take at least 5 years of your life. Be
Mm-hmm.
prepared for that. There is no shortcut. There is nothing like that. Thirdly, I believe anybody can be successful. There is nothing like I'm from India, Pakistan, Egypt, or some other
Mm-hmm.
country. Will I be successful or not? Basically, before you ask anybody to guide you, like I want to come to Australia, just
Mm-hmm.
go spend like 3 or 4 days of your life on these websites, which is
Mm.
surgeons.org, AOA, APRA. Then you should come and ask somebody very specific question.
Mm.
Like,
Yes. That.
okay, look, I have done this one. I find like how the logbook is going to play. Is there any other way? Can you guide me with my CV? Can you guide me with the job? These are the specific questions. If you ask me, like, I want to come to Australia, then guide me, then I cannot guide you.
That's right. I mean, I get
Yeah.
YouTube comments and I get, mails that I'm an orthopedic surgeon with that much of experience. Can I come to Australia? I don't know where to start answering this kind of question. There's a process. Have you oriented yourself to that process?
Yep.
I'll just rapid fire some questions which get
Yep.
top three questions which I get asked.
Okay.
I have no consultant experience or a very brief consultant experience back home. Can I apply for a specialist pathway here in Australia?
Yes, you can. As I mentioned, like their requirement is, the training program basically. But
And
my
then successful
advice
completion
would
of that
be
training program to be on the specialist
exactly,
register.
if you
Yes.
if you are a consultant over there in your country, including like MS plus 1 year of the senior registrar experience in
Yep.
India or in Pakistan, yes, you are eligible to apply for sure. But eligibility is one thing, and getting a successful application is another thing. And this is where I felt like you should work in Australia for a couple of years to build your CV.
All right. The
Not
other question,
mandatory, but important.
recommended. The other question I get asked about that there are recency requirement that look, I'm coming working here in Australia or going another, I'm getting further away from my core orthopedic work. Would that hamper, because I'd be looking for a job? I come to Australia, I'm looking for a job. Would that count against me because I would now lack the recency experience? Which I don't think it's the case, because you can pretty much apply for jobs online. You don't have to have a
Yes.
break in your career to take up a job here. You can apply for fellow jobs. You can apply for unaccredited registrar jobs.
Yeah,
So
my feeling is they should not work as unaccredited registrar because that's a very low level kind of a job, I would
Mhm.
say. If you want to come to Australia and work as a consultant to lateral entry, the minimum is you should work as a fellow,
Okay.
not as an unaccredited registrar. That's
Mhm.
that's one thing. And secondly, you can come here for two reasons. Either just to do a fellowship. If you are a knee surgeon, you want to do a fellowship in knee, then the recency of practice does not matter because you're a knee surgeon anyway, and
Mhm.
you're
Mhm.
coming to
Mhm.
work with the knee surgeons.
Mhm.
For lateral entry, yes, as I mentioned, they are going to evaluate you as a newly qualified orthopedic surgeon with general experience. So if
That's
you
right.
are a spinal surgeon back home in India or Pakistan, or you are a hand surgeon, then you should be really serious on thinking what you are doing because
Mm.
you will need all those experiences. I mean,
Yeah.
there is no shortcut.
That's it. Well, thank you very much, Dr. Shiraz. I think this was
Uh,
very insightful. I also learned so many things, and there were so many questions which I did not even ask because you already answered those questions by yourself. So I'll stop the video here. Thank you very much.
no, that's
And
all good. Hopefully, it will help few people in their
journey, absolutely,
journey.
100%.